Hi, I'm Dr. Matt from LifeWorks Integrative Health, and in the next part of our series of avoiding knee surgery, avoiding knee pain, and really getting to the root cause of the problem, I'm going to go over the physical structure of the actual knee and zoom in on that so you understand the components. If you saw our last video, we spoke about the actual structure of the whole lower unit of the body, from the hip all the way down to the ankles. So if we just zoom in here on the knee, let's talk about that so we can clear up any confusion with what types of cartilage are there and the anatomy that's within the knee. So when we start to look at just the knee joint itself and blow it up, we have the femur, the tibia, and the fibula. Those are the three bones that are going to be making up that knee joint and that articular area. Now, if you remember from our last video, the knee joint is supposed to be a very, very stable joint. The knee, the ankle and the hip joints are very mobile. So you have two mobile joints, and in between that, you have a very stable joint to the body, which is the knee joint. Okay, so let's understand what happens with the knee joint. So we have two different types of cartilage that are inside the knee joint. If we look at the ends of these bones, where I've got it shaded in green right there, this is a type of cartilage called articular cartilage. This cartilage is very hard. It's on the ends of the bones. It provides a surface for those bones to begin to move on and move very smoothly, okay? Now, in between those bones, we have another type of cartilage, but it's softer. It's more spongy, and it acts as a cushion for these bones and the weight of your body coming down on it, and that's called your meniscus. And that's this area right here that I've got shaded blue. Now, the cartilage on the end plates of the bone are very hard. The meniscus cartilage is very soft, or softer than the articular cartilage. Now, the mistake that people make many times is they mistaken the difference between these two, and they kind of just combine them all together. Many times when people are having knee pain or a cartilage tear or cartilage issues, it's a result of this meniscus breaking down first. Not as much the cartilage on the end of the bones. What we will see with the cartilage on the end of the bones is over time, the wear and tear will begin to cause cracking, holes, and degeneration within that bone that can create pain. This is a result of abnormal biomechanics and friction caused in that knee joint as a result of dysfunction, and we're going to go over that in another video so you understand how that kind of evolves and develops. What happens more with the meniscus is because it's compression and we're twisting and we're turning on it, we'll get cracking and fraying, and then sometimes you'll need a surgery in order to have that removed. But we're also going to talk about other options in another video to even avoid surgery potentially for meniscus tears. So in the next video, I want to go over some of the soft tissue now that's around that knee joint so you understand how that all comes together.